optimally, most people, the consensus is a live cell-based antibody assay for MOG is helpful, in part because a lot of the time when we have weak antibody titers, things get confusing. We see some overlap with patients we would probably call multiple sclerosis. And so the optimal assay is going to perhaps help us navigate those patients with low titers that may or may not truly have MOGAD. One of the limitations is labs that undertake live cell-based assays aren't necessarily widely accessible. And so a lot of parts of the world may simply not have access to live cell-based assays. And so these criteria also include contingency plans for when you don't have a live assay, when you have a fixed assay, which sensitivity-wise may be more challenging. And then there are parts of the world that don't even have cell-based assays at all and are using ELISA-based assays. Most of us would agree those results are very challenging to interpret. And so I think one of the goals going forward is looking for cost-effective assays that can tell us as much as our expensive live cell-based assays, but are more readily accessible. And in the world of NMO, we are seeing these dot and blot assays that can be done much more cost-effectively and in centers without necessarily a high-yield immunology lab, but are still informative. And I think that is also going to be a part of MOGAD that we're going to see explored further as well.